Hi there. Thank you so much for being here. We are going to be talking today about the 2016 Cabarrus County Community Health Priorities. I'm Lauren Thomas. I'm with Healthy Cabarrus, and I'm excited to share with you what our priorities that we've chosen for 2016 and for the next few years that we'll be tackling together as a community. My hope today is that you can gather the information that we have here. You can see what the priorities are, what data that we've looked at, and what I'd love from you is to get feedback to see where can we go from here? What do we need to learn? What kind of insight do you have? What is your experience in the community as far as the priorities that we have? Consider how this information aligns with perhaps your organization that you work for, or perhaps the family that you're in. How does this information ring true to you? So Healthy Cabarrus is a partnership. We're almost at 20 years. We were founded in 1997, and we are a partnership of community partners, community agencies that we work together on a few priorities every couple of years, and we are trying our best to create a healthier community, building a culture of health for Cabarrus County. Like I said, we were founded in 1997. We have over 40 local agencies who are a part of that. That's municipalities, that's our county government, that's our hospital system here, Carolinas Healthcare System Northeast, Cabarrus Health Alliance, which serves as our local health department, several nonprofits in the community, as well as our school systems, Chamber of Commerce, and other higher education programs like Rowan Cabarrus Community College. We also have over 150 individuals who are involved. So that's people like you, perhaps. That's our residents who live in Cabarrus County who also give us insight on making sure that we're reaching all of the different pockets of populations in Cabarrus County. Here are some partner agencies that are involved, and what I'm specifically wanting to talk to you about. Healthy Cabarrus is a broad umbrella of groups. Specifically, I'm going to speak to you today about our Community Planning Council. Our Community Planning Council was 40 representatives from 40 different agencies, and here are some of the different agencies. Cabarrus Regional Chamber of Commerce, Project Safe, Cooperative Christian Ministries, Free Clinic, United Way, and a variety of others. And our challenge was to look at all of the data that we have around Cabarrus County and find out what are the most pressing needs that we can address collectively together. So after we decide what our priorities are, we then write a report. And this is to catalog and document all of the different data that exists for Cabarrus County in this time period in 2016. And a variety of different organizations and people in those organizations use this information further in their organizations. Brent Rocket from YMCA, Cannon Memorial YMCA, he has said that he used this as part of their strategic planning, as a part of the rationale for creating the Share the Harvest Urban Farm. They learned through 2012's Community Needs Assessment that Cabarrus County has several food deserts, and food deserts are something where there are census tracts where there's not a lot of access to healthy foods. So the YMCA, they saw that information and they said, we're going to do something about that. We're going to create an urban farm. So that's great that Brent Rocket was able to use the information gathered from Community Needs Assessment from 2012. Dave Zablotny, he's the Executive Director of Habitat for Humanity in Cabarrus County. When he moved into the community, he used the Community Needs Assessment from 2012 to orient himself to really understand what the needs are in the community. He was new to the community and he wanted to make sure that he really understood what the experiences were of his future clients. So we're very grateful that he thought of the Community Needs Assessment as a go-to place to get that information. And Alyssa Smith, she is a grant writer at Cabarrus Health Alliance, which is a local health department here in Cabarrus County. And she uses the information from our needs assessments to write grants and to justify why we need funding in the community for a particular health issue. So I wanted to share with you the different phases of our community needs assessment. Our Community Planning Council was oriented of all these phases, and we have a very comprehensive framework. We use this framework through the North Carolina Department of Public Health. They give us a great layout of, if you follow this plan, step 1, step 2, step 3, you will have a comprehensive understanding of your community. So phase 1 to phase 5, if you can see, is a sort of a blue zone here. That's what we charged our community planning council to do. Phase 6, phase 7, that's the phase that we're in right now in our community needs assessment. And phase 8, after we do all of this, after we get feedback from the community, we will then write a report and we will start planning and start making some action in our community. So phase 1, we established our community planning council. Those are the 40 agencies that we had a representative from each of those agencies. Phase 2, we collected primary data. Primary data is where we ourselves collect, we survey the community and we collect data on our own. Secondary data is where there's other institutions, say the census, say the schools. Other groups have already collected data for us, and we're going to gather all that data. HUD, Housing and Urban Development, some other groups of the State Department of Public Health, perhaps. So primary data is where we're collecting data on our own, and we did that. Secondary data is where we collect it from other people, other institutions. So one way that we collected primary data is we had a Photo Voice research project. We knew that a lot of the data that we look at is adult-driven. It's questions that we ask adults and tell us about your experience, adults. But we knew that there was a gap there in that we wanted to get the voice of our youth. So we worked with our school systems, we worked with Cabarrus Arts Council, and we solicited 15 teens in the school systems, and we asked for them to, as a part of a photography project, what makes you feel unhealthy and healthy? What makes you feel safe and unsafe in Cabarrus County? We made a very concerted effort to get representation from all of the county, as well as taking photos all throughout the county. So we had zones. So certain teens stayed in the Kannapolis area. Some teens stayed in more of the Midland or Mount Pleasant area. So we also had an exhibit afterwards, after we looked at all the photos, and we found themes from these pictures. And we found for our teens, for our young adults, they see health and safety being in our EMS, seeing our fire trucks be there, seeing greenways and trails. What makes them feel unsafe and unhealthy is when there is neglect in our sidewalks or broken streets so that they can't walk on the sidewalks. There are other things too, but that was really important for us to collect this information on our own. We also collected primary data. We did a survey, and you may have received this survey. It was almost 2,000 residents in our community were surveyed, adults, on their community experiences. And what we asked them were 44 questions. Some were demographic questions, but the majority of those questions included, in the past year, have you had an unmet health need? Have you had an unmet educational need? So we were trying to gather that information, and I'll show you some results later on, but that was important to us to not just rely on secondary data, but also find out from the people that we serve if they also had that same experience. Phase 4, this is where our Community Planning Council met on a monthly basis. We looked at this data and we talked about it. We talked about a variety of health issues, meeting in September of 2015 and ending in May 2016, just a little while ago. We talked about income and employment and unemployment, education, so the high school graduation rates, high school dropout rates. We also talked about safety and the perception of safety in neighborhoods. We also had a conversation around social connectedness and how important it is to keep communities not feeling so isolated, and what are those vulnerable pockets of people who do feel isolated? What are the health consequences when they feel isolated and they don't feel like they have someone that they can talk to? That was important to us. We also talked about weight and food and physical activity. In February, we talked about maternal and infant health outcomes, as well as substance use, drug use, and sexually transmitted diseases. In March, we talked about housing, substandard housing. We talked about public transportation opportunities and environmental health, which included air and water quality. April's meeting, we talked about the healthcare quality. So if someone wanted to get quality health care in our community, does it exist? And access to that care. What is the experience of our individuals who are uninsured? And lastly, in May, we had a culminating retreat where we decided, okay, after looking at all this data, what should be our top 3 priorities? Because we can only choose so many. We wanted to consider the magnitude of the issues. There's a host of different health issues out there, but magnitude means how many people does this affect? That can be a challenge for some because some issues are widespread, some issues are very unique and specialized. We wanted to consider the consequence of the issue. What if we don't address this? What kind of death or disability is going to come if we don't address issue A over issue B? And then finally, we wanted to consider the feasibility of our success. So we do change or we readdress our priorities every 3 to 4 years. So what can we do in 3 to 4 years together as collective partners, agencies? What can we do in 3 to 4 years that can make and measurably improve the outcomes in our community? So that's a big piece. There's lots of issues that we would love to work on, but there's only some that we know that we can feasibly address in our community. Our 40 representatives in our Community Planning Council voted. It was a very transparent process. They put their sticker dots that they voted with on a whiteboard so that everyone could see what they were voting on. So this is where they take off their hats as far as their organization and really vote in the way that's the best for the community, not necessarily for their organization. So here are the final results. It was pretty clear that our top priority issue is substance use. We, as well as nationally trending, we're finding that prescription drug misuse is a big issue, not only in Cabarrus County, but North Carolina as well as the United States. This idea of pain management and appropriate pain management. Mental health, separate from substance use, mental health is also an issue. This idea of, do we have access to care for our mental health, the folks who might need to talk to someone. Maybe it's somebody who's licensed, maybe it's someone who's a layperson. And obesity, child and adult overweight and obesity. We've got a great movement already going as far as we have coalitions coming together. So obesity needs to remain an issue. Obesity was an issue in 2012 and that has stayed the same, as well as mental health, and a subset of that was substance use. So I wanted to give you some data behind what we found and why did we decide substance use, mental health, and obesity should be our top priorities. This is some of the data that we did look at. We found that, in 2015 and 2014, our Substance Use Coalition from Healthy Cabarrus collected primary data. They went out into the schools and surveyed 10% of our high school and our middle school population. And they asked them specific questions about risky behaviors. They asked them questions around their substance use in their lifetime. And one of the questions that we asked, have you ever used these substances? Ever use meaning in your lifetime, have you ever used one of these substances? This was an anonymous survey, and 10% of the public school population did take this. Our high school students did say that yes, alcohol, yes, 40 to 46%, depending on the year, they have tried alcohol. Our high school students said this. Cigarettes, 16 to 21%, depending on the year, said, yeah, I've tried a cigarette. That's compelling to me, being that Cabarrus County was a home base for Philip Morris. And there's some, considering all the other substances, we're making some strides there. But there's still some work to be done. Marijuana, even more so than cigarettes. High school students have used marijuana. And so that's compelling to see. In 2016, we do have a marijuana concern. And what's also concerning is drugs without a prescription. So we have high school students who are using prescription drugs, which is a very, very powerful medicine, that's not theirs. They were not prescribed that drug, and they're using it. Perhaps it was shared from a parent, perhaps it was shared by a grandparent in a well-meaning way, or perhaps they're finding it on their own. But this is something we do need to address, and our Community Planning Council felt so felt that way as well, because the consequences if we don't could be dire. We also learned through vital statistics data that in 2014 we had 22 drug overdose deaths in Cabarrus County. That's just from what we know of death certificates. Many other folks may have passed away due to drug overdose, but perhaps on their death certificate it was stated, respiratory issues because they were having a hard time breathing. But what we do know is that at least 22, we know that number is probably much higher, but at least 22 people died of a drug overdose in 2015. To us, that's a big deal. That's something that all of those we may have been able to prevent through naloxone, which is a sort of like an EpiPen in the way it's injected, but it's a drug that can reverse the effects of a drug overdose. Lastly, we know that the front lines of our community are paramedics. They see a lot of community health concerns right at the front lines there. EMS phone calls. We asked our EMS to provide us statistics on how many phone calls are you getting, how many times are you having to respond to a drug overdose. And in 2014 and 2015, over 400 times. This is an issue. So multiple times our community resources are being allocated and reallocated to deal with a drug overdose. So this was concerning to us, and we felt that substance use absolutely needs to be at the top of our list as a priority. Mental health was also a concern. So in our survey that we sent to our community and getting almost 2,000 responses back, we asked the question, where do you go as a first access point to mental health care? If you had a mental health care crisis, where would you go first? What was the most compelling to us was 36%, over 36% said, I wouldn't go anywhere. I don't seek mental health care. I haven't in the past year. I don't seek that type of care. Another thing that was interesting is of those who do see someone for mental health care, where do they go to for their first access point? Was their primary care doctor, their doctor's office. So that's information for us to say our primary care providers need to be trained in how to assess, identify a mental health situation, and appropriately refer if they don't feel that they're trained to take this on. Third was that a first access point is a mental health provider. So this is helpful information for us, is people who are in a crisis moment, who are having a difficult time deciding what to do in their mental health crisis. Third on the list is their mental health provider. That's who we would like for them to see first, but that's not necessarily the place that they go first. We also asked, in the past year, have you had an unmet counseling need, and what was it? For the top three, we had anxiety, depression is the top reasons why people may have had a counseling issue, but they did not go to see someone about it. Household finances, this is an interesting subset. Household finances is a stressor for our community. And marital or relationship problems. So these are the top three unmet counseling needs in Cabarrus County. We also learned that we have a ratio of mental health providers. So we have one mental health provider per 401 residents in our community. That's in line with the state average, but it's still something to consider, is that perhaps we don't have enough trained mental health providers. This in particular was looking at licensed mental health providers. We know that there's also incredible value in our church laypersons and our clergy, and in talking to a friend. But this in particular is looking at our licensed mental health providers. Lastly, we also want to talk about mental unhealthy days, that people feel that they are mentally unhealthy. That was a question that was asked through the state. And Cabarrus County residents say that on an average month, 3.2 days they feel mentally unhealthy. That's 10% of our Cabarrus County residents' lives, is 10% of their days they feel mentally unhealthy. So that's an indicator for us that, yeah, we've got a great need in our community. And lastly, overweight and obesity. We found that North Carolina children, though we don't have Cabarrus County children on this slide, North Carolina children ages 10 to 17, 36% of them are either overweight or obese. This particular data source is from CHAMP, that's the Child Health and Monitoring Program run through the state, and that's a self-reported by the adult, the parent of that child. Were they diagnosed with a BMI that was overweight or obese? So there's still some limitations to that data, but we do feel that that's compelling that over 1/3 of our state's children are overweight or obese. And adults, even dire of a situation. In North Carolina, we have 65% of our adults are overweight or obese. We were able to kind of whittle that down a little bit and get access to Charlotte regional data, Cabarrus County being included in the Charlotte region, and we had 61% of our adults were overweight or obese. So that's less than the state average, but that's still not good enough for our Cabarrus Community Planning Council. And lastly, one of the questions that we asked within that primary survey was how many minutes per week do you get in physical activity? What we found was only less than 1/4 of our residents are getting the appropriate amount of physical activity per week. The appropriate amount of physical activity per week, as stated by the American College of Sports Medicine, is 150 minutes per week. So that's half an hour, 5 days a week, or some sort of ratio like that. So only 1/4 of our community is getting that recommended amount. So we've got a lot of work to be done. Any questions before I move on as far as those 3 priorities? Okay, I'm going to move on, but if you have questions, let me know. One thing we wanted to look at within our primary surveys was who are our most vulnerable pockets of population. We found that adults who are uninsured are very vulnerable in our community. So when we move forward with talking through substance use and mental health and obesity, we need to keep in mind what's the experience of our uninsured adults. The barriers that they face are the ability to pay and their access to care, because if they don't have an ability to pay, then that really does limit their access to getting the treatment that they might need. There's also variances in geographic locations. We know that there are certain census tracts in our community that have a higher number of issues that they're having to face, a lot more barriers they're having to face. We talked about the food deserts. There are some food deserts in our community, so there's a lack of access of healthy foods. Perhaps there's a lack of access to public transportation, and a host of other things. Sidewalks, physical activity, greenways. So there's geographic locations that have a more pressing need in our community. So we do need to concentrate on those areas and plan for that. Spanish-speaking families, just due to literacy issues, perhaps they are, seeing a lot of words that are in English and they're having a hard time translating that, or we don't necessarily have a translator on staff when they're accessing healthcare. And they may be ineligible for some assistance due to just the documentation of their citizenship. And then families in transition. This is sort of a global term for families who are moving from house to house to house to house. Perhaps they are having a hard time paying rent. Perhaps they're having a hard time paying their utilities. Perhaps they're homeless. Perhaps they're living in substandard housing. So we do want to keep in mind our individuals who are living among us who are living in substandard housing. We know that there's a strong link between substandard housing and poor health. So I want to ask, how does the data that we collect compare to your experience in Cabarrus County? And I also want to ask you, what else do we need to consider? What additional advice would you recommend? That's something that, as you have kind of thought through this data, as you've seen this presentation, what's hitting home to you? What are your sort of first thoughts? What are your aha moments that you may have? And I'd love for you to consider going to our website, healthycabarrus.org. Go to healthycabarrus.org. We have a tab. You can learn all about Healthy Cabarrus and our coalitions that are working towards these health issues. But we do have a tab called Contact Us, and we'd love to get your feedback that way. Thank you very much.